We know that gun violence is really bad in America, obviously, but there's a lot that we don't know about it, in part because a lot of studies that hypothetically could have happened did not, because the federal government was effectively blocked from conducting that sort of research, but perhaps not in the future. And joining us now to break down this potentially momentous change, Jonathan Metzi, professor and director of the Center for Medicine, Health, and Society at Vanderbilt University and the author of Dying of Whiteness. Welcome to the show.
Thanks so much, it's great to be here.
I'm glad to have you here, and for good news, which is pretty rare. So tell me, before we get to the new legislation that we're gonna talk about, tell me about why these studies haven't been done in the past and what effect do you think that lack of research might have had?
It's kind of an unimaginable situation that we've had in this country for the past, 2 decades, more than 2 decades. In the mid-1990s, there were a series of studies in leading medical journals that basically showed that having a gun in the home was a risk factor for having a shooting in the home. It's hard to imagine how that wouldn't be the case otherwise, but 2 big studies, one found that having a gun in the house increased the chance of a domestic shooting, another found that having a gun in the house increased the chance of a suicide in the house, a gun suicide. And the NRA and its supporters basically took this as an opportunity to say there's an anti-gun bias in public health research, which wasn't the case. They were actually showing real statistical correlations. And they used that to add a rider to the federal budget in 1996 called the Dickey Amendment, which effectively blocked the federal government from using the kinds of funds it normally uses to study, cancer or tuberculosis or car accidents. It basically blocked that kind of funding from going to gun research. And what we've seen is about a 2.5 decade ban on those kind of research studies. And so effectively these large scale studies that would ask important questions, what are the best gun safety procedures? What are the best state level policies? What kind of storage practices are the safest that we should be knowing, because we live in a country where there are an awful lot of guns, but those big studies haven't been done. And really, I think what we're seeing now is hopefully that dam starting to break with at least with the outline of the new congressional budget.
And it is really amazing. Like tens of thousands of Americans, at least every year, die due to guns, and the government is
almost 40.
Almost 40,000, and they're banned effectively from finding out how that might be helped. Like this is an obvious threat to the American people, and due to that rider, they can't look into it. Really fast though. So from the research that we did, it appears that it doesn't explicitly bar the research, but it did effectively stop it. Why then, even with, for instance, Democratic presidents, have they not been able to get around what isn't an explicit ban?
Well, the resilience of this particular issue, of course, because when you pass a budget, you need a lot of people to sign off on it, and it's been kind of a non-starter for budgets really since the mid-1990s.
Yeah.
And so every time, even they renewed the Dickey Amendment effectively, and in fact it expanded every couple of years. They did it, 2 weeks after the Charleston shooting. They did it. It's just been part of the federal budget process, and it's basically been a non-starter from the Republican side that has effectively blocked the budget process. And the effects, as you suggest, are really incredible. If you look at, for example, if you just correlate the deaths by a certain pathogen versus the amount of money that we study it, gun violence was at the very bottom. I think it was linked with next to like leprosy or something in terms of just the amount of money we put into that. But as you say, at the same time, gun deaths have been rising. So it's kind of, every time there's a mass shooting, we ask, well, how can we stop mass shootings? And the honest answer is we don't know, because we don't have the research. So it's had a profound effect on research. It's had a profound effect on publications. It's had a profound effect on just the careers that leading researchers go into. And so, again, what we're seeing now is, I think, not just the Democrats pushing, but what's important now is that I think the Republican side is willing to admit that there's so much frustration about this issue that at least the indication we have so far is that the Senate and the president will sign off on this budget, which would be a big symbolic change.
So Jonathan, it's Jayar. So we talked about the misinformation that they've been pushing this since the 1996 over this, just to not even get the studies to know the information on it. And this is obviously nothing new. So I want to compare it to the way that we're doing with climate change. There's information about climate change, but there's still not much legislation on a broad scale to actually do something about it. So I guess I'm the pessimist here. So I love that there's going to be this studies and the information is going to be out there, but how is that going to correlate to then switching over to allowing lawmakers to actually do something about it when it comes to law. Like we have plenty of information, and once we have it concrete in our face, we'll just say, information's there. Now we won't do anything about it. What's going to make that switch on this?
Well, that's really the vital question here. In other words, what's being promised, at least in this congressional budget, is $25 million, which is definitely a lot in terms of, somebody's life, but in terms of what it costs to actually study a problem, we put billions of dollars toward, smoking and HIV and things like that. So it's not a ton of money. But I think the question is, how much money does it take to address the issue of having a gun around or having bad gun policies leads to more deaths? You could probably solve that with $25, in a certain kind of way. And so the question is going to be, if we find out what policies work best, is there the will to implement those policies? And so research, I think what research does is it gives validity to arguments, right? It gives validity to basically saying there's science behind this. But as we see with climate change, it's a perfect example. This is not the age of where we value expertise. It's easy to discredit expertise. And so the real question will be, does that research lead to better policies? And particularly in this case, does that research lead to federal policies, right? Because the problem with gun policy is, I'm in New York today. New York has great gun policies for the most part, relatively low rates of gun injury and death. Tennessee, where I live, it's the opposite. And so it's really, are we willing to take policies that work and implement them in pro-gun red states where there are a lot of guns around? I think that would be the big question.
Yeah.
One last question for you. So we've apparently got the funding, or at least it seems likely that it'll be signed. And credit to Representative DeLauro for working on that. But I guess it's just a question of prediction. The money is going to be allocated, but Donald Trump is still president. Do you think that it is likely that it will actually be used in the way that it's intended?
Well, this money is earmarked, again, $25 million for the CDC and the NIH. Who knows? Prediction is we're not doing great with prediction right now. I would say that, there's a huge budget. There's also, money for, raising the vaping age and other kinds of things. So there are plenty of kind of social red flags here. It'll depend. I think that the balance is, on one hand, $25 million to the CDC and NIH. It's a symbolic victory, but it won't dramatically change the research landscape. And as this is happening, there's a whole other issue going on, which is that a lot of gun policy is being dictated in the Supreme Court and in the judiciary. And so I would bet, if I had to guess, that this budget gets signed, just because there's so many other kind of pro-gun victories happening at the judiciary level, not at the research level right now, that I think that ultimately, people were saying, this means the NRA is weak, and I don't read it that way. I think that the NRA is very strong in the courts, which I think is a very important issue, because ultimately that's where we're going to dictate whether or not these policies are brought into the real world.
Okay, well, we certainly appreciate you joining us on the show. Jonathan Metzi, author and professor at Vanderbilt University. Thank you for joining us.
Anytime, thanks so much.
Check out the Damage Report podcast each day, wherever you get your podcasts, whether Pocket Casts or Stitcher or iTunes. You can join me as I give you the news and stories you want, with a range of co-hosts and interview guests jumping in on the fun each day. Again, that's the Damage Report, wherever you get your podcasts. And if you get them at iTunes, don't forget to rate and review. Sometimes I'll read them live on the show.